Hello again. Almost 600 doctors are ready to serve in various communities. They came through Cuban universities as part of the Nelson Mandela Fidel Castro Medical Collaboration Program. This program aims to alleviate the dire shortage of doctors in South Africa. Let's discuss this now with the Minister of Health, Dr. Joe Phaahla, and Dr. Sifiso Kubayi, who has just graduated in Cuba. Good afternoon, gentlemen. Thank you very much for your time this hour. Minister, you must be feeling very proud about this latest cohort in terms of the Nelson Mandela Fidel Castro Medical Program.
Well, very, very proud, Raden, and proud of Sifiso. We were together just over an hour ago at the University of Pretoria, Mamelodi campus, where we graduated 594 new medical doctors. We're breaking records. This is a result of a big intake of young South Africans coming from rural areas and from the townships, from poor families, who were selected in 2012, starting from 2012 onwards, when a number of provinces came on board to submit, candidates, which constituted at the time per year just over 900 new intake of medical students going to Cuba. And down the line now, just over 10 years after that, we've been graduating quite a number. Just in December last year, we graduated just over 1,000 at the University of Limpopo. This was nevertheless accumulation because of COVID of a number who had completed. So just between December and now, just over 1,000, I would think, over 1,600 who graduated between December and now from this program. So a major injection of this new young medical practitioners, mostly coming from rural areas and townships and from disadvantaged families.
Dr. Kubayi, let me bring you in here before I continue with the minister. I guess congratulations are in order. Are you excited about your new career?
Yes, I am. It's quite an achievement. It's not something I had initially planned, but I'm happy that it happened. And I'm also happy that...
yeah, what did you initially plan? You didn't plan to be a doctor?
No, I had planned to be a doctor. It's just that the circumstances when you get that side are different. It's one of those things where it's a challenge that you face, but you're not sure whether you can overcome it or not. So that's why I'm saying it's a joy to be here. It's a joy to be witnessing this day today.
Yeah, no, congratulations are in order, and we wish you well. I mean, Cuba is known globally for its approach to community health and to primary health as based on prevention and promoting of good health care rather than the curative health care that we've got to know here in South Africa. What lessons are you going to be bringing into the system in the country?
Well, first of all, I think we'll take that lesson of prevention. We need to start applying that one in our own health system, because most of the problems we face in the hospitals are things we can fix before they even get to the stage where they are. It would be easier to allow our people easy access to healthcare facilities, or rather, should I say, have more of those facilities available to our people, because primary healthcare would require more facilities where people can get more information and care.
Okay, Minister, let me bring you in. What will happen now to Dr. Kubayi and the rest of the 594 cohort that have just qualified? Do they come into the system immediately, or is there some form of a transition because they qualified in Cuba?
Well, the reason why we're having this graduation today is because they have actually already completed their integration from the Cuban training into the South African health system. So they have spent about 18 months. Some may have taken a little bit longer, a few of them, but most of them would have arrived in July of 2020. So were then admitted into the South African medical universities and worked with the locally trained student into various clinics and hospitals, and they completed that. And then they also got examined by the local, health specialists, passed their clinical test, and then also did a final Cuban examination. So they are fully integrated, qualified. In fact, as we speak, except for a few who there might be a few things to sort out, the large majority of them are already placed in local South African hospitals, started with their internship. So there is nothing more now. They are fully qualified, registered with the Health Professions Council as interns. They are ready now to really hone in their skills as medical interns. And then in 2 years' time, in fact, many of them in 1.5 years' time, they will be qualified as medical officers. So there is no further academic work to be done.
Oh, okay. Dr. Kubai, the minister saying that this program has been benefiting students from across the countries, particularly from rural areas, disadvantaged areas. And I see the 594 are literally spread across the country. Minister, I was looking at your speech a little bit earlier on. Where are you from, Dr. Kubai? Are you going to be going back there, or are you going to be deployed elsewhere?
No, I'm going back there. I'm from Limpopo. I'm currently deployed that side. I'm working in Polokwane.
Okay, are you working in the main hospital in Polokwane?
Yes, in the main one.
Okay, we cannot pretend while having this conversation that our healthcare system does not face challenges, as we all know. We get reports now and again. For you on the ground as a newly qualified doctor, what difficulties are you facing, and are you getting any assistance?
Well, the most challenging.
Okay, I think we lost that connection there with the doctor. I can't hear the doctor now. Minister, are you still with us? Oh, okay. Are you back? Sorry. Dr. Kubai, we had a blimp there. We lost you for a while. You can carry on.
Yes, I was saying that the major challenge we're facing is the shortage of material we use around the hospital. Yeah, that's the biggest one. But other than that, in our integration into the hospitals, the seniors are actually
okay, we seem to be having a problem there. Apologies for that. Minister, let me bring you in. You are hearing Dr. Kubai says the main challenge he's facing now as he starts as a new doctor, it's the equipment, it's the material, the resources. How do you respond to that?
Well, that's a continuous struggle, Braden and the viewers. As you would know, the supply of consumables and also equipment for diagnosis, for treatment, all those things, you have to keep your supply chain system, running at all times. So it's something which we're working on with our colleagues in the various provinces, in the districts, to make sure. I mean, we've developed systems, for instance, in terms of the pharmaceutical supplies, surgical supplies. We do have an internet-based system through which various clinics, hospitals have a way in which they can record on a daily basis what is their stock levels of various items, so that that can report to their provincial depots, but also here in Pretoria, at the National Department, we are able, if they record on a daily basis, we are able to feedback. We're able to say to them, check out this and this item, it's on the low supply, please make sure that it's replenished. But it all also depends on the compliance of our staff on the ground. So this is something which we have to improve on a regular basis, and of course make sure that we've got the necessary financial resources, so that when something is in short supply, people come to, those who must order, make sure that this consumables, especially pharmaceuticals and other equipment, that they are ordered in good time. So that's something which we have to improve on a regular basis.
Yeah, and it's something to think about. And having spoken to some CEOs of some hospitals, a hospital like Chris Hani Baragwana, for example, in Soweto, cannot procure by itself. It cannot, for example, fix the boiler. That has led to over 800 surgeries not being done in the last 2 years, because it has to go through these lengthy procurement processes under your department. Maybe it's something to think about, to say, could you begin to think about decentralizing some aspects of procuring those materials that are in short supply now? Dr. Kubai, I've got you back. We lost you there, but the minister had your concern and he was addressing addressing it. They're saying that they are very much aware and it's an ongoing challenge. But you're back in Polokwane, and that's where you come from in Limpopo. And are you specializing? Are you going to be specializing, or are you just going to be a GP type of a doctor going forward? What's your plan, Dr. Gubai?
Well, the plan is to specialize. I'm not planning on staying a GP forever.
And what kind of specialization? What kind of specialization?
Which one? I'm down to 2 options right now: general surgery and internal medicine.
Okay, they're sort of related. Well, we wish you well and all the best with you and the rest of the colleagues that have now graduated. The road ahead is going to be full of challenges. Minister, final question to you before I let you go. I know you need to travel just now. Since '97, this program, the Nelson Mandela Fidel Castro Medical Collaboration Program between South Africa and Cuba, has produced 2,556 doctors. You said in your speech earlier today, and we're still facing shortages of doctors. We've got the latest 600. For how long will you continue with this program?
Well, we intend to continue with the program. We're talking to our colleagues also in the Ministry of Higher Education, so that, because up to now, the program has been supported by our provincial health departments, coordinated by us at the national level. But with the pressure on financial resources in the health department, we want to continue with the program. We want to bring in also our colleagues in higher education to see whether some of the bursaries which are available for, they've got the NSFAS for locally trained students. We want to explore whether some of that money could also provide for this program, because it's not only adding numbers, as you said earlier on, very strong in what we are very weak at, which is health promotion, prevention of disease, primary health care, and community health. So those are the areas which we want to work, bring other colleagues in the higher education to see if we can tap into some of their resources to keep this program alive.
Okay, Minister Dr. Joe Pahla, thank you very much for your time this afternoon. And the newly graduated Dr. Sfiso Gubai, all the way from Polokwane. We wish you all the best as well on your future of your specialization. Hopefully you'll know which of those 2 areas you'll choose. Thank you very much. They're talking to us, of course, after the latest graduation of 600, nearly 600 doctors who are ready now to serve in various communities. They graduated a couple of years ago in Cuba. They've now done their integration in South Africa, and they are ready to be deployed, or already have been deployed to various posts across the country.